Are you settling for treatment when you deserve care? Last year, shortly after I moved into the new office, the neighborhood had a block party. And at the event, I had a great time. I had the pleasure of meeting all my new neighbors. And one person really took me under her wing. She's like the matriarch of the neighborhood, and she's so outgoing. And she went around and made sure to introduce me one by one to all the people in the neighborhood. And it was really wonderful. And with warmth and enthusiasm, she shared their names and their professions and how long they'd lived there, and even some amusing stories about them. And of course, I didn't remember anybody's name, but luckily she sent us an email that had everybody's name, so it was wonderful. And then we came to this one guy, and he wasn't even from the neighborhood. He was a friend of a friend who kind of just glommed on. And as soon as she said I was a chiropractor, he did this thing. And he grabbed his neck in one hand and he grabbed his lower back in the other hand. And he said in this mocking voice, "Well, thank goodness I don't need one of you guys." And, early in my career, I would have been really offended. And I might even tried to engage him and try to rechange his mind. But I realized he was right. Now, you might be surprised to hear me say that. But here's the deal. We were not having the same conversation. He was talking about treatment, and I talk about care. No healthy person needs treatment. You wouldn't take a healthy tooth and drill it and fill it. You wouldn't take a blood pressure pill if your pressure was normal, so you wouldn't use treatment. So he didn't have pain, so his mind said, "Oh, gee," and in his defense, he didn't need my care. All right, so here's the distinction. Treatment is necessary when a person crosses a threshold where symptoms appear. That signals that the body can no longer heal itself. And at this point, outside intervention is absolutely required in order to address the issue. That's treatment. Now, care, on the other hand, is a proactive and preventative. It's not about waiting for symptoms to arise, it's about ensuring that your body stays healthy and fully functional. Care involves regularly checking your spine to maintain its proper alignment, educating you on nutrition, managing stress, eliminating toxins, ensuring your body is resilient to life's everyday stress. That's care. So anyone can do care. The healthiest person can have care. A child can have care. An adult, senior citizen can have care. Everyone can have care. Now, the spine is very predictable. When you fall, when you have poor posture, when you have daily stresses, this can begin to disrupt normal function, and it starts a cascade of changes that gradually reduce its motion and flexibility. And with regular care, these issues can be addressed before they progress. Like imagine living your life with flexibility and the motion of a child, strong, resilient, and adaptable. That's the vision I have for you. My advice, get checked. Regular chiropractic care isn't just about feeling better, it's about living better. Thank you for taking the time. I look forward to working with you in the future.